So the frequency is the time from the beginning of one contraction to the beginning of the next, and it's measured in minutes. Whereas the duration is looking specifically at the start of the contraction to the end of the contraction, and that is measured in seconds. Then we talk about the intensity of a contraction, and that is referring to the strength of the contraction. A mild contraction lasts about 30 seconds, and it's going to occur every 5 to 7 minutes. A moderate contraction is going to last closer to a minute, closer to that 60-second period, and it occurs every 2 to 3 minutes. So again, remember, in the decrement phase, as a mom is beginning this labor, as mom is feeling these contractions, she knows, okay, we feel one coming on, we've got the increment, we're going to incrementally build up, build up, build up, we're going to have the acme, that's the worst part of it. Now I know that we're going to have a decrement period, we're going to start losing, some of the strength of that contraction, and we're going to have this relaxation period here. And again, what is happening during this relaxation period? Is mom sipping on a mimosa? No. This period of relaxation, she is catching her breath. And really what is happening, though, is the relaxation of the muscle fibers, and we have perfusion actively taking place. So a way to kind of give us an idea of, well, when we're talking about palpating a contraction, a mild contraction, when you press your finger onto the tip of the nose, you know how you kind of got a little bit of a bounce here, okay? That's kind of a mild contraction. It's under, over a strong, you can still have some rigidity underneath of it. Moderate is pressing your finger on your chin. Still a tish bit of bounce, but you've got just that firmness underneath. Whereas forehead, there's no bounce. There's no recoil. There's nothing. And that is the strength that a good labor nurse, when she's palpating a contraction, can determine. Okay, premonitory signs of labor. So when we're talking about premonitory signs of labor, we're talking about signs that labor is either going to occur or is in the process of occurring. So these are the signs that specifically we're looking at. Cervical changes. So the cervix begins with that that softening, what we talk about it. It becomes more receptive to that thinning process. We have possible dilation. Really what's happening is that that fetus is descending further into the pelvis, kind of reaching part of that, especially with those first-time moms, reaching that state of engagement. And this can occur up to a month before the onset of labor and as late as an hour before. So once again, as the fetus moves into that true pelvis, perhaps not fully at that full engagement process yet, but perhaps in those negative stations, the uterus is sinking downward and forward, and we have this what we call lightening. So it's not reflective of like the cervix feelings of lightening. Like the one patient that came in with complaints of crotch lightening, that's not what we're referring to, which is like usually the presenting part, like banging on a cervical nerve, which does hurt like the dickens, but that's not lightening. So lightening is the mother can breathe easier because that fetus has descended into that lower pelvis, into that true pelvis. Obviously, with the baby into that true pelvis, like I said, breathing easier, but you have increased pelvic pressure and you have to feel like you have to pee more. Primips, they can have this lightening or this, like, we also refer, I never heard of it as lightening until I taught this course. I've always heard it as drop. Oh, you look like you've dropped. Okay? And we see the physical manifestation from the outside, from onlookers, where we can see that uterus has sunk down. And first-time moms, about 2 weeks prior to the onset of labor, multips possibly when labor begins. Like, you don't get a break if if you've had multiple deliveries. It's like your body is just like, shoot, we're going to hold everything in until the absolute last moment, and then it's just going to go bonkers. Braxton Hicks contractions, y'all know what Braxton Hicks contractions are. They're not true contractions. Well, if they're not true contractions, then they're not doing anything, right? Wrong. They are doing things. It's just not the laboring process. So this is a tightening and a pulling sensation of the uterus. It's felt across the abdomen, and what it's doing is it's actually moving the cervix from a posterior to an anterior position. You don't want your uterus, your cervix and everything pointing back when it comes time for delivery. You want it, you're going to be laying down, you want it, everything to just be able to shoot out, right? And that's what that's your goal. And that's what these Braxton Hicks contractions are doing, is they're moving that uterus towards the anterior position. They also help to soften and ripen the cervix. Now, softening and ripening is different than dilation and effacement. It all plays a part in it, but those are different terms, okay? These can be decreased by walking, peeing, eating, increasing fluid intake, changing position. Our dehydrated nurses who are pregnant and working those 12-hour shifts on the floor and not drinking because, it's more important to feed the other 3 people that you don't have time, that nobody else has time for, rather than to feed and drink yourself. And heaven forbid, Joint Commission see that we actually drink water during our breaks or, during our shift. So those are, you have to worry about your nurses and people in similar type positions where they're not taking breaks like they should. They start to have more of these Braxton Hicks contractions. You get them to rest, you get them to drink, and those Braxton Hicks contractions will subside. They typically last around 30 seconds, but they can last up to 2 minutes in duration. If I have a 2-minute contraction, I'm thinking something's happening. And I get really bummed out. I didn't have Braxton Hicks until my 3rd one, and I was like, are you kidding me now? Bloody show. This again is that loss of kind of that mucus plug. It's happening because of that cervical ripening and increased pressure. Cervical mucus, as you have that thinning and softening process occurring of the cervix, like you lose a little bit here. You lose a little bit here, there, and you're like, woohoo! There are whole blogs, you guys. There are whole websites. If this isn't a world that you are familiar with, then brace yourself, because this world is just unbelievable. But these ladies get on and they're like, oh, I've lost my mucus plug, and everybody goes, oh yay, congratulations, labor's gonna start. And if you're a first time mom, you start to get like all geared up and excited for that, only to have nothing happen for another 2 days. And then you lose a little bit more of your mucus plug. And you're like, it's the same thing. 3 days go by. You'll lose more of your mucus plug. Well, for anybody that's ever seen a true mucus plug, like, it is a glob of mucus. It is not like this little mucusy discharge, this cute little mucusy. It is a full-on glob. So it is the full-on glob that we're talking about that can be indicative of labor within 24 to 48 hours. Okay. Spontaneous rupture of membranes, or SROM, well, yes, that is going to be indicative of labor, because in our world, if you have not delivered within 24 hours, we are going to deliver you within 24 hours. We're going to try to augment your labor and get things going, because your risk of infection begins to, dramatically increase the longer that you're sitting there ruptured. Remember, again, if that baby is not engaged, that could lead to that cord prolapse, which is an obstetric emergency. Weight loss, about 1 to 3.5 pounds. Moms can have that. And then this surge of energy, that nesting that we talk about, where everything has to get done, and it's random stuff too. Like, suddenly my cupboards have to be organized, as if anybody sees my cupboards. But I want it all done before that baby comes. Alright. And I'm just going to